FAVMI presents Unfolding Mental Illness, hosted by Saraswati Suresh.
Hello, everyone. Unfolding Mental Illness by FAVMI, Family's Voice on Mental Illness, which is also the regional chapter of Face Me India, is back with our next episode, Ask the Expert, Series Part 2. By this series and podcast, we try to bring about tools, resources, experts, and inspirational stories, and we hope to bring better understanding of mental health and also create more awareness in the mental health ecosystem. I am Saraswati Suresh, founder of FAVMI, the host for today, and I have my co-host, the director of FAVMI, Dr. Sachin Kanukar. 1st July was celebrated as the National Doctors' Day, and FAVMI and our team would like to thank all the doctors for their service and trying to help the human mankind out of here. Thank you so much. So we continue with our episode of Ask Experts Part 2, and we have our guest and Dr. Krishna Prasad with us again. As you're aware, these are all questions which we have collated from family carers, and we have been asking Dr. Krishna Prasad. Dr. Krishna Prasad is a very young, dynamic, and an amazing psychiatrist based out of Bangalore. He has done his medicine from Bangalore Medical College and then MD from NIMHANS. He's currently working as a professor of psychiatry and the head of Psychiatric Rehabilitation Services at NIMHANS. So to continue this episode further, I request Sachin to take it forward.
Thank you, Saraswati. Thank you, Dr. Krishna. Thanks a lot for your time. And thank you for being a part of our episode in continuation to what we did last time. So we would start with the family environment because this is one question we see in our groups. So can I start with my first question, Doctor?
Sure.
Thank you. So one of the most important questions which originates is, how did this mental illness come? Was it due to an overprotective family environment? Was it due to a single parent? Was it due to bad parenting? Or was it not enough time given by the parents, etc.? So how would one actually answer this in a more scientific manner?
Yeah, I think this is a question that often comes with families, because I think sometimes they assume that they are responsible for their family members' illness. And I think it was also kind of bolstered by older kind of theories which held the families and the parents responsible for mental illness. To say that they are responsible for mental illness, I think it is untrue. It is rather more important that to understand that mental illness can be manifest because of several reasons, including genetic reasons. Substance use, for example, use of drugs like cannabis can also contribute to mental illness, and stressful environment. Now that stress can arise in different life situations. All of these could contribute to mental illness. You may not be able to pinpoint a single cause in an individual. Very often, either stress or substance use is a precipitant in the context of a genetic background of mental illness that runs sometimes in the families. Sometimes medical problems also can be causes or can be precipitants of mental illness. Say, for example, use of steroids sometimes is associated with, say, depression or what we call as mood symptoms or affective symptoms. So these could also contribute to mental illness. So it would be too simplistic to say that families are responsible for mental illnesses. In a way, families are responsible for the upkeep and care of people with mental illness. So a very warm environment that is very encouraging, environment where there is optimum level of involvement to the family probably would improve the course and prognosis of a person with mental illness. At the same time, one needs to understand that very negative expressed emotions in the family, say for example, being very hostile or being very critical of somebody or being extremely over-involved, not allowing the person to function independently, can result in poor prognosis or poor course of a person's mental illness. So family does contribute to the course and prognosis of mental illness. The families are responsible for day-to-day caregiving in many ways, prompting for several activities that during the period of acute mental illness people may not be able to fully function independently. I think those are times when the families critically provide support, and in the long run, sometimes when people don't achieve as much recovery as they would want, I think the families provide financial, emotional, and various other kinds of support that the person with mental illness requires. So I think families in many ways can provide support and protect. In certain situations, they can probably, by, for example, being more involved or by being hostile or critical, or their understanding being poor, I think in such situations may probably contribute to the poor course and prognosis of a person with mental illness. So I think there is both a very positive aspect about families being there. Interestingly, in countries like ours, where families are present to take care of people, we at least know from studies that the course and outcome of people is far better when compared to other countries where the families are not available for support. So I think families are the pillar and support for people with mental illness.
Thank you, doctor. That was a wonderful explanation, because a lot of people go back and try to understand where it has come from. So thank you very much. The second question is about marriage, because it's like a social institution in the country. The question is often asked: can they get married, or will they sustain in their marriage?
Yeah, I think this is a question that in our cultural context often arises. We do see some people who believe in the fact that marriages may probably improve or make a person more responsible, and it is in this context that many a times families want the person affected with mental illness to get married. There is also a social obligation or a kind of cultural and religious obligation that one needs to get his or her son married or daughter married. I think sometimes all of these come to the fore when the question of marriage arises. Having said that, I think in the current times, I think marriage is a very personal choice, a very individual choice. We do see people with and without disabilities aspiring to get married, finding companionship or some kind of a romantic relationship in general. So I think it's a very personal choice. But yet, in our cultural context, the family has a lot of say in the marriage. So I think as a dyad or as a family and the person with mental illness, I think this decision has to be taken probably in discussion, and one has to decide about what kind of responsibilities does a marriage entail, what may happen in terms of both benefits and the difficulties that may arise because of the marriage. Sometimes the most important question is about disclosure of the fact that the person has a mental illness. It is not easy to find a bride or a groom if somebody discloses the fact that he or she has mental illness. Then it becomes a major challenge. To what extent should one disclose? Again, this is a very personal choice that one decides to make. Very often we do see people who disclose the fact that they've had mental illness in the past or they currently have mental illness fully, and sometimes this is very easily accepted by the other side, but very often we see that the other side does not accept the fact that somebody has mental illness and completely are not willing. So we do see very supportive spouses. We do see spouses who kind of don't react very adversely when subsequently the issue surrounding the disclosure of mental illness becomes, very apparent to the family member. So I think hiding would be with its own risks, because then one would easily discern while, say, somebody is taking medications, or if the symptoms come to the fore, I think the wife or husband will come to know of it, and then I think the response that this person affected with mental illness has to give, and the family is, there are manifold challenges there. So to convince, to talk about why they hate, and I think that becomes a major issue. It would be wise to disclose probably, but then your prospects would reduce because there are challenges in the society's acceptance of mental illness. Having said that, we do see people who accept it subsequently also and lead successful marriages. So-called normal people also have difficult marriages. So it's not a very one-size-fits-all kind of a response that one could have as far as marriage is concerned. So I think it's not an easy decision for parents to take, but I think they should weigh the costs and benefits that are involved in the process. And I think the responsibilities one has to take. I think it should not lead to a situation where you take care of. Sometimes we do see people who get the daughter or son married to somebody from a little lesser social strata in the hope that they would be then understanding. But it's not always the case that people have achieved success in the process. Sometimes people with disabilities decide to get married with another person with a disability. So it may work, it may not work. So it's not a very easy situation to predict for anybody to. But I think with some degree of support and I think some degree of transparency, I think things could be better. And I think it's a very individual choice that one has to make then.
Thank you, doctor. I think there were, two wonderful answers. First for the family, and second about marriage, because these are these are issues which actually people immediately discuss when a disease like mental illness is diagnosed in the family. So thank you very much. I think that was very nice to understand and hear. After that, the question which is there as a result of marriage or whatever relationships people have is the question of childbirth. Is that can people conceive in a normal way? Does the medication cause miscarriage? Will our children also get mental illness in case there is a family, there's a mental illness, and will it get transmitted to the next generation? So if you could please throw light on this, it would be of great help. Thank you.
I think people with mental illness can conceive. There is no such barrier that they cannot conceive. But there are some precautions that they might need to take. We need to understand that, say, for example, with the use of antipsychotics for, say, people with schizophrenia or sometimes for people with bipolar disorder, there are some side effects that people may experience. Say, for example, sometimes the use of antipsychotics can lead to erectile dysfunction. So sexual side effects can be seen with the use of antipsychotics. So to an extent, fertility and conception may be affected if this happens. But I think, and also obesity and sometimes the development of metabolic disorders with the use of antipsychotics can affect both the sexual satisfaction as well as the chances of having conceiving. So I think these are things that one has to keep in mind in the background. Also, when women decide to, or as couples, I think, decide to look at pregnancy, I think this is something that they have to discuss with the doctor. And there are some medicines that are used, for example, with the use of lithium. One has to be careful when a woman is pregnant with lithium, because there are chances of certain congenital anomalies, that some teratogenic effects that the drug can have on the fetus. So I think these are things that one has to keep in mind. So I think a close liaison with the psychiatrist who is treating, some precautions, because with the use of some antipsychotics, I think doctors would recommend the use of folic acid, because that would protect from some so-called defects that can happen in the fetus, so that affect the neural development. I think these are things that the doctor would discuss with the woman who gets pregnant while on antipsychotics. So I think these are things that one has to keep in mind. And sometimes even across the trimesters, I think a close liaison with the gynecologist is something that you might want your psychiatrist to talk to the gynecologist. And sometimes crosstalk is very useful, because I think each specialty brings its own kind of very unique perspectives to pregnancy. I think those are things that one has to be very careful while. So the doctor may wish to reduce the dose of antipsychotic. The the gynecologist may wish to do certain tests because somebody is on antipsychotic. So I think these are things that, say, monitoring of sugars across the trimesters or monitoring of drug levels. I think these are things that the psychiatrist may wish to advise. So I think these are things that one has to keep in mind. So it doesn't stop at that. I think post the delivery also, breastfeeding is something that becomes very crucial for the child's development. And I think there are situations when certain medications may be differentially secreted in the breast milk. I think these are things that the doctor may advise the mother about managing breastfeeding, maybe choosing alternatives. Even while being pregnant, I think choice of alternative medications, because some of them are relatively safer than others. So I think these are important issues that you would wish to discuss with the doctor. So I think the choice of some families, some couples choose not to be on any drug because they believe that if symptoms are not there, now they don't want to risk anything. But there is also the risk of relapse while the pregnancy is there, and post delivery also there is a risk of relapse. Sometimes the risk of relapse can cause more damage than the medication itself. So one has to be very careful about taking this decision. And I think done in the doctor may help the family or the couple to take a decision based on the past response, the past course of the illness, and the current amount of recovery that the person has had. I think based on all of this, I think the doctor may help the couple take a decision about how much of the antipsychotic should be given, whether the dose should be reduced, whether an alternative that is relatively safer should be given. I think these are things that a doctor may help decide. I think these are important in the context of delivery and pregnancy. I think the other question was about the chances of the child having a mental illness. The chances are definitely higher if the parent has a mental illness, for the child to have mental illness. And if both parents have mental illness, then the chances are even more higher. But having said that, a protective environment, it's not as though to say that, like several other genetic conditions where there is a very straightforward kind of a relationship, with mental illness you may not see that kind of a straightforward relationship. So it is not 100% true that everybody will have mental illness. We do see people not having mental illness in far more numbers than the children having mental illness. Definitely, compared to children of normal parents, these children may carry greater risk. So nobody can say that very definitively. So I think during the vulnerable period, one has to be watchful. I think that is the only precaution that one could take during this, while taking this decision of having a child. I think there was another question I might have lost.
No, I think that's wonderful. I think these are three important questions which Saraswati and the team have framed, which is first about how does it come, how does the mental illness come, what is the impact on marriage and child work. I think you have wonderfully explained it and summed it up in the minutes we have spent. So thank you very much, Doctor. I think there would be questions, and we would definitely collate and also discuss it in our next few episodes. I just wanted to share some narratives which family have shared, and we would request your feedback. One of the narrative is the patient has been on medication for long. He or she takes medication, eats and sleeps. He or she is not bothered about anyone, nor does he or she take responsibility of the house. When will this behavior change?
Yeah, I think people with long-standing illnesses can have several, barriers or hiccups in the process of recovery. So we might see a good amount of improvement in so-called positive symptoms of, say, illness like schizophrenia, the voices that they hear, or the abnormal experiences that they have, or say the false beliefs that they may be harboring. All of that may respond well to medications. But some other manifestations of the illness itself, say for example, not showing interest in activities that they previously enjoyed, or say being less social than before, not speaking as much as you would want, not showing emotional responses as much as you would want. I think these are things that may not respond very well to medications, and to an extent only possibly it was believed that the previous antipsychotics, or what we call as the typical antipsychotics, did not show great improvement in the so-called negative symptoms of psychosis or schizophrenia, whereas the more newer antipsychotics like olanzapine or risperidone or even clozapine would show a good response to, or a better response to these negative symptoms. But I think over a period of time, people have realized that even with the so-called second and third generation antipsychotics, the response to negative symptoms has not been very good, and people do struggle with these challenges of not being as social, not being as interactive, not being as motivated, or not taking initiative to do things that they would be expected at their age. I think these are some challenges that do persist. So I think this is where a psychiatric rehabilitation program may be helpful. So helping them make a structure for the day. Help. Sometimes it is because of a long-standing demoralization that sets in, because while they compare themselves to their peers, so they may not have achieved as much as they would have wanted. Somewhere the education gets affected, or there is a break in the work that they are doing, so they are kind of lagging behind several other people. So this kind of creates a loss of self-confidence for people, and this cycle, I think if it affects any of us so-called normal people as well, I think this is a very negative, it kind of has a very negative loop, and I think that is where people then start getting demoralized. Families start becoming critical sometimes, because they feel that he's not doing anything. So this kind of criticality sometimes makes the person lose the self-confidence even further. So these medications may be causing side effects. So the doctors, the person may not have the initiative to even tell the problem that he or she is facing. So I think sedation can be something that, or stiffness with the use of antipsychotics, slowness with the use of the drug. So I think all of this can affect, and the person then has what we call a secondary negative symptoms. A negative symptoms that is a part of the illness itself, and a negative symptom that sets in because of the adverse effects of antipsychotics or medications, depression, and sometimes people who are institutionalized for a long time lose the drive to do what is there, what is normally expected of them in the outside world. So all of this could contribute. So I think gradually bringing a structure to the day, helping them sometimes do tasks that are far simpler than what you expect them to do in terms of their qualification or their pre-morbid self. I think those are things that could help them enhance confidence. Probably engaging them in activities that were interesting to them, say as hobbies before that. I think gradually achieving some degree of mastery, and if there is pleasure associated with the activity, I think that kind of activity they would probably prefer to do than a very complex kind of difficult kind of activities. So I think this should start immediately after the acute symptoms abate. The earlier the better. I think that kind of gradually helps them get back into the groove and start life as much as you would expect them to do.
Thank you, doctor. This was immensely helpful. I think this is what a lot of families are struggling with today.
Sometimes what is not recognized is that they also kind of have challenges in thinking, processing information. So sometimes cognitive assessment or assessment about memory, their ability to think and organize themselves, and helping them with some kind of remediation program for that would be helpful in certain instances.
Thank you, doctor. This is immensely helpful, because that's what a lot of parents and family members are worried about, and it was a very comprehensive answer. Thank you. I think we have got very good answers for the questions what we have asked, and these are questions which have been bothering families for a long time. A question from the parents: till we are alive, we can take care of him and her, provide him and her food, remind him to take their medications, wash their clothes. We are worried of what may happen after us. How will they lead their life after our time?
Yeah, I think what after parents is increasingly becoming a major worry across different social strata. I think each social background that a person comes with certain advantages and certain disadvantages. We do see now families being increasingly nuclearized, and even siblings. I think it's very difficult then for parents to kind of see what happens to them, what happens to the family member who is affected over the years. I think it suddenly becomes imminent at a point when they start having their own health issues, and I think that is when sometimes for families it becomes a sudden thought as to what after me or what after the parents. I think these kind of questions naturally arise. Now, as a parent, I think there are different domains that they probably need to think about. Whether the son or daughter is able to take care of himself or herself in terms of activities of daily living, say, for example, self care, or say, instrumental activities like, for example, transport, taking care of the finances, managing laundry, cooking, whether these are things that he or she is able to manage. So, if he or she is able to manage this independently, I think then there is a fair degree of chance that he may be able to lead the life independently. I think recognizing early that these are important trainable aspects that one could focus on would be important. Not so much focus on the symptoms alone, but also on these other important life skills or life activities that are necessary for leading life. So I think it shouldn't suddenly happen that you don't know what to do. I think as a part of treatment and recovery, I think these are all aspects that need to be addressed. One other important thing is medication management. So we do see people with illness who do have the recognition that they have some form of symptoms. Some of them don't have insight. Some of them have partial insight. I think getting them to work with their doctor in terms of the insight is something that is very important. In some cases, it probably may not result in a full awareness or acceptance of the fact, but there is some degree of acceptance of taking treatment. I think if that is ensured, to an extent, the parents' concerns about medication management can be, can be to an extent mitigated. But I think also looking at several other life issues, like, for example, ability to manage property or ability to manage finances. So these are things that the families might need to, or the parents might need to look at before that. I think it's wise if there are some provisions from the government. For example, if there are the parents who were in central government agencies or in state government agencies, there is a provision of pension transfer for people who cannot definitely earn their livelihood. So, in such cases, I think ensuring some degree of financial security becomes important. Where you decide that your ward is not able to stay independently, I think you should also look at the option of a long stay facility. So, the long stay facilities are far and few across the country, and some of them are exorbitantly high in terms of the charges. So one might need to make a compromise and see a way in between sometimes, or see if you can ensure, if you think there is some fair degree of independence that the individual has, set in some kind of a framework to protect, either in the form of a trust or in the form of somebody who assumes some degree of guardianship. So all of this can be something that the families can think of. So there may not be a very straightforward answer to all of these, and individual families might look at. Sometimes there is a sibling with whom the person gets along very well, and the sibling may be able to take care in the long run, and there is no formal guardianship that may ever be required. But then there are sometimes people are suspicious of their family members, or there are situations when two siblings, not for reasons of mental illness but for other reasons, don't get along well. So I think those are some challenges. Sibling is living abroad. We do see families where they decide to take them abroad and provide them care. So these are things that different families may choose to do differently. So I think once individual living situation and circumstances might, and the person affected might decide as to how things may go. We have a family caregivers group that has formed a trust, and they have kind of decided to experiment by all of them. I think a group of 40 families or so. They've decided to buy a lot of land and probably take care of each other's wards when each of the families, the parents pass away. So that kind of arrangement that they are looking at is something that is novel and experimental. But these are people who can afford and have the wherewithal to do all of this. But there are families who don't have this wherewithal. Some people don't wish to take this risk. So then you might need to look at other options, including for the person to stay alone, as well as to look at long stay facilities as well. So sometimes legal consultation can be useful to set up guardianship, to set up trust, to manage the properties, and to make use of a nominated representative who assists the person in the process of taking treatment.
Thank you, doctor. That was very elaborate. I think these are very important questions which you answered, and you answered it so well. I think it's been a great session, and I think a lot of information has been shared. Thank you. There's one question which people have asked, is that he or she never understands me whether I'm in a sad mood or in a bad mood. I have to adjust to their ways. He or she never comforted me or spoke caringly.
Yeah, so I think again, this could be a manifestation of a individual's mental illness itself, what we discussed as negative symptoms. The fact that they no longer show the degree of care or affection that you would have seen them show or display while they were so-called normal. I think that can be a part of the illness itself. Sometimes it is also possible that this may have been their own personality or the way they respond to people from the beginning. So it varies from one person to another. So they can be what we call as empathetic to people's difficulties or challenges, and may simply show no response. Say if somebody is not well or not keeping well either in terms of health or financially, so they may not show any response at all. So this ability to take perspectives, to understand the other person's situation, may simply be a manifestation of the illness itself. Sometimes it could be the fact that from the beginning they are like that. Sometimes it's a consequence of the interaction that has kind of persisted over a period of time between a very critical parent and a very non-responsive family who is affected.
Thank you, doctor. The one question is, made him or her study engineering, and now it is more than 10 years. He or she doesn't have a job. Even if he gets, he or she is not able to maintain it.
Yeah. So I think job is something that all of us aspire to, because it kind of gives us a degree of satisfaction, some degree of hope for the future, and some degree of financial securities. There could be several reasons why we choose to work. And I think for people with mental illness, we do see people have a lot of breaks in their career, some kind of disjointed work history that we see. So, and over a period of time, as we discussed, because of the de-skilling that happens because of long periods of unemployment, or because of the cognitive deficits itself that are a part of the illness, so they struggle to get back to work. So I think in the high-income countries, there is this program called as the supported employment program, where the return to work post the acute hospitalization or symptoms is an important target in the process of recovery. Even there, I think, even with the degree of support that is available there are challenges in terms of job acquisition is something that may happen soon, but job retention is something that people find there are difficulties in. We do see that people with mental illness require some degree of what we call as reasonable accommodation at workplace, or what is called as some kind of workplace adjustment. So, for example, people with who have visual impairment have braille that is there to support them. People who have locomotor disability might have difficulty in accessing buildings, so ramps are made available, or other adjustments at workplace are made available. So similarly, the kind of adjustments that people with mental illness require may be different I mean, though accommodation is required, but the nature of accommodation is difficult. They might require longer induction period at workplace, longer period of training. They might require some degree of support in terms of a supervisor who kind of one-to-one helps them. There are frequent breaks that they may require because they may not be able to sit through. Because of the side effects of medications, you might need to provide them flexible work shifts. So these are kind of adjustments that many of these supported employment programs make in the West while they provide. But such kind of programs are not easily available in our country, and probably I don't think so. There are such programs actually existing in the country. So in the absence of that, it is on a one-to-one support. Sometimes people receive from the mental health professional that they return to work. And very often we do see them taking jobs that are far below the qualifications that they may have. We do see people who are contented because they are working in some way or the other, may not be commensurate to the kind of qualifications that they've had in the past. So sometimes families we do see families who are kind of happy because they're working, not working necessarily in an engineering job, but some other job where there is some degree of satisfaction, some degree of confidence that the individual, some degree of financial security that comes with the work. So I think it is important that cadre of professionals who help people join work or return to work is something that our country should also prioritize. And there are cadre like vocational specialists, job coaches, there are occupational therapists, psychiatric social workers. All of these can be very helpful in the process of joining work. Earlier, there was a thought that getting back to job itself can be stressful, and stress can induce mental illness. I think from these supported employment programs in the West, I think what they kind of now say is that job probably is also therapeutic to an extent. So helping them get back to job is an important part of recovery. So there are challenges because we don't have systems in place, but I think one should look at job as an important aspect of recovery.
Thank you, doctor. I think that's a food for thought for all of us who are actually managing this, and for families, and also for a society to actually think about people who need help and who need this kind of a support. He or she keeps doubting me always. I feel ashamed when my children and other family member hear it. It's tiring to keep reminding him or her to bathe and keep herself or himself clean. She does not bother about household chores. Even cooking is very bad. I'm stressed out about managing everything. Unable to bring my friends home because the home is dirty, and my wife does not groom well. How do families manage this?
I think, as I mentioned, these are important activities of daily living that we routinely do and assume that this happens automatically without much effort. But I think with people with mental illness, these can get affected while they're acutely ill, and sometimes these can persist because of the negative symptoms that they may have. So some of the things like making the house dirty may be a part of the disorganization that may be seen as a part of the acute mental illness. Sometimes it's because of negative symptoms and no initiative to do things. I think there are no formal services to assist families with these, but I think in liaison with the mental health professional, finding a suitable system of what we call as behavioral activation, some degree of structure to the day, some degree of use of daycare in the process, so that they have something to look forward to through the day. So they have to prepare themselves to attend daycare where the pressures are not high, where there are no expected targets or deadlines for them to meet. I think sometimes all of this brings in a kind of system where they have to prepare themselves, they have to keep themselves clean. Sometimes use of suitable rewards. So these are some things that families try. Sometimes the families are taught how to prompt them, how much to prompt, and how much to kind of coerce, how much to kind of cajole. So I think all of these things can be taught by mental health professionals, and it can be useful. So if it is a symptom of if it is a manifestation, sometimes we do have people who are affected with mental illness because they will not take bath because they believe that there is a camera inserted in the bathroom. then I think the medications and optimal dosing or choice of medications can bring about improvement in these aspects of life. So sometimes it's because of negative symptoms, then it becomes a little bit of a challenge. Persistent effort from the family and the mental health professional can be something that can be useful. Sometimes families may decide to admit their person affected with mental illness in a halfway home, because a halfway home kind of an environment may help them bring a structure to the day. They may have some kind of a support that they may receive from other professionals who, say, for example, social workers, who may assist them in looking at the hygiene, structure to the day. So all these aspects may then be taken care of. So I think these are some choices that families may have as far as this is concerned.
Thank you, doctor. I think that's a very pressing question because a lot of families actually face this, and I think that was a very good answer. Uh, there was one question about how do families manage discrepancies about patients' mental illness within the family members, because mostly the father or the mother cares for the patient, and the other members remain uninvolved, and also blame the parents for patient's condition. So it's like a double whammy. How do you approach this situation? And how to make the parents understand that the child or any member of the family is suffering from psychological problems?
Yeah, I think there can be differences of opinion in the family about the nature of the problem itself, and even if the problem is recognized, how to kind of deal with the problem. So there we do see families where the choice of treatment, some family member may wish that allopathic treatment may be the best way to deal with the problem. Sometimes the other family member believes that a complementary or alternative medicine form may be useful, say for example Ayurveda or homeopathy. So people can have differences of opinion, or sometimes there can be blaming that you are responsible for the person's symptoms. So this kind of a very difficult environment definitely is not conducive to the person's recovery. So it kind of affects the day-to-day functioning of the family. I think both the family members and all the family members concerned should probably be meeting the mental health professional, discussing frankly their choices and opinions, and if required, might require consultation with a family therapy specialist, who may be a psychiatric social worker or a clinical psychologist, who may look at the various dynamic issues between the family members. And these may not be really sometimes related to the mental illness. Sometimes it can be a consequence of the change that happens in the family because of the mental illness itself. Sometimes there is a pre-existing alliance in the family. You do see families where three family members are together, one person is different. We do see situations where one person is kind of very scapegoated for many things, and different family dynamics. We do see communication patterns between family members which are not very helpful. So I think these are some things that a clinical psychologist or a psychiatric social worker might help the families deal with. So I think that is something that you can also consider if the situation is very difficult.
Thank you, doctor, for the wonderful answers about families and the narratives. I think it's been a very informative dialogue and understanding about all the points which you have shared. I would now request Saraswati to take over and continue the session further. Thank you, Saraswati.
Thank you so much, Sachin. Moving on from narratives to physical health. Okay. Obesity is one of the bigger challenges which families face. Of course, one is the side effects of the medication, but then also there is a lack of motivation from the patients to do exercises, and families also try pushing their wards into doing exercises, but it's always a big challenge. Some recommend yoga, some recommend meditation, and some say no, meditation is not good for PMIs. What is your take on this?
I think physical health related issues are some things that were not recognized as important in the process of recovery till a few years back. But I think increasingly it is being understood that there is a bidirectional relationship between physical health and mental health. So I think particularly people with severe mental illness, physical health has been ignored traditionally and continues to be ignored because the focus of the families is so much on the mental health related symptoms. The doctor was also extremely focused on the mental health related symptoms. And since you mentioned that the obesity is an important consequence because of the illness itself, the sedentary lifestyle that the person may adopt because of the illness itself, not going to work, not having a daily schedule, not having a structure to the day, and also because of the fact that the antipsychotics induce increased hunger, or because of their the fat accumulation that may happen because of the use of antipsychotics itself. So the changes in the lipids that may happen, all of this may lead to poor physical health. And definitely people with mental illness are at greater risk of developing diabetes mellitus, hypertension, and even premature mortality, dying early. So at least it's now well known that people with mental illness across the world die 10 to 20 years earlier than the so-called general population. So I think so it's important that physical health related issues are recognized, particularly what we call as non-communicable diseases, which themselves carry the risk of, say, heart-related ailments in the future, or say brain-related ailments like stroke in the future. So I think these are important things that one has to, and the other negative consequences that may happen because of conditions like diabetes, which affects the kidneys, the nerve endings, and the eyes and several other body parts. So I think one has to be mindful that these are an important aspect of discussion with the doctor from the beginning, and whatever, I mean, these are a consequence of different reasons, including dietary choices that people make, the amount of physical activity that they engage in, sometimes other risk factors like smoking or use of alcohol. All of these kind of interact with each other and lead to the problem. I think each of these factors, sleep related issues. So I think all of these need to be addressed in the discussion with the doctor. Physical activity definitely is an important part because we know that physical activity can alleviate our mood, can elevate our mood and alleviate mental distress. It kind of releases so-called the happy feeling hormones within our brain, and that can be very important the process to improve motivation and engagement in several other activities. Yoga similarly has been found to be useful as a part of treatment of mental illness as an adjunct to several other treatments that are available for mental illness. So yoga, particularly the different asanas that are a part of yoga, can be very, very useful and more acceptable to people with mental illness. Meditation, I think, may be something that one has to be very cautious about. One might have to discuss that with the doctor. Deep forms of meditation and very intense forms of meditation probably are something that may not be advisable for people with severe mental illnesses. So I think those one has to be very careful with as far as. But yoga, in terms of asanas and other physical activities, purely physical activity based yogic postures may be very useful.
Okay. Moving on to addictions. Okay. So, what is the connection between mental illness and addiction?
Yeah, so I think there are some definitely the use of substances or substances of abuse is higher in people with mental illness for several reasons. Some substances, like for example, the use of cigarettes or other smokeless forms of tobacco, definitely are substantively higher in people with mental illness than compared to general population. Sometimes these are used to alleviate the experience of symptoms that the person may be experiencing. It is sometimes used to alleviate anxiety that is associated with the symptoms, and sometimes people feel that they're able to think better because they are smoking or because they're using the cannabis. So while this brings some degree of temporary experience of improvement, in long-term use can definitely have very harmful consequences. And I think there is little realization of the long-term consequences because the consequences are not very immediate. And also because these substances of abuse, particularly drugs like cannabis and smoking can give a very immediate kind of a feel good high. So there is this need to go back to it again and again, and they gradually over a period of time hijack what we call as the reward circuitry in the brain, and then it affects the person's ability to stop oneself from using these substances. So I think those are some challenges that you see. Smoking, particularly in the context of use of medicines to treat the mental illness, can have other effects also. For example, it can lower the dose or lower the blood levels of some medications like say clozapine or olanzapine, and then I think the effect of the medication in terms of symptoms of the illness may itself be affected. So I think while people are smoking, the doctor might decide to increase the dose of clozapine. There are treatments available, options available for say smoking. For example, there are nicotine replacement therapies that are available. There are medications that can be safely used to reduce the degree of smoking that the person is engaged in. So I think these are some things that one has to discuss with the doctor. So the use of drugs like cannabis or alcohol or some very hard drugs, I think one has to consult the concerned treating doctor and take necessary steps to deal with the use of these substances.
In fact, you've answered also my next question of, how the addiction interferes with the process of medication. Yeah.
So it can affect the level of the medication in the blood. So because at least with smoking, it is fairly clear. So I think one has to then discuss with the doctor about the dose of medications and look at options to bring down the smoking. So sometimes the target may not be complete abstinence. So it would be ideal for somebody to completely be off smoking or use of smokeless form of tobacco. But even harm reduction is an achievement. Some degree of cutting down on the amount of cigarette smoke. I think that can be the initial target where people are not motivated to completely stop smoking.
Yeah. My next question is more from the youngsters' point of view. Today's cannabis usage. It's like it's legal in a lot of countries and states, and they feel that okay, there's nothing wrong in doing cannabis. And it's also shown in a lot of movies, and people taking it just for fun, and it's become a part of life for some people. But how does it really affect the mental well-being of a person? I mean, I really want you to give the message to the youth on this.
I think in general, cannabis use has several adverse effects. Though in our country there are regions where, for social reasons and for cultural reasons, cannabis has been. The use of cannabis is definitely likely to affect a person with mental illness quite significantly. So I think it can precipitate psychosis. It can cause mood-related disorders. So it can cause panic. It can cause anxiety-related symptoms. I think all of these are negative kind of effects that cannabis has on the health and body. And I think cannabis smoking also has several other effects on several other systems of the body. So I think having said that, the positive effects experienced because of the use of cannabis, I think that probably kind of drives people to use it again and again. And I think discussion with the doctor about what can be done about the cannabis use, including options that medical options that can help them reduce the craving, sometimes other psychological interventions that can help them in the process of getting themselves rid of use of cannabis. I think these are some things that one has to discuss with the doctor in such situations. So cannabis use definitely has a direct relationship with both mood disorders and psychosis. So these are important issues that need to be addressed as far as people with mental illness are concerned.
Yeah. Is there also a connection between the PMI wanting to eat more of junk food and meat-related, the more those kind of food, and which leads to more obesity? Is there a connection?
Yeah, I think at least with say conditions like bipolar disorder and depression, as a part of depression itself, people might have excessive appetite or excessive hunger as a manifestation of the depression itself. So we do see sometimes when we are stressed, we do consume a lot of food,
Yeah.
so-called unknowingly, and we do end up eating a lot. So we end up binging a lot of. Usually, it is carbohydrates that we end up with. So I think similarly, so it's directly related to the mood state that we are in. So sometimes it's a very much a symptom of the illness itself. So in other situations, say for example, in the case of psychosis, it could be because of the effect of the medication. So medication can increase appetite, increase the hunger that is there. And as a consequence, usually it is the carbohydrate-rich foods that people consume. So also sometimes people who use drugs like cannabis, they may have appetite changes that may also lead them to take food choices that are not really good for the health.
Okay. Yeah. Okay. What is your, families handling stigma? Okay, which is a very big chapter in our country today, and discussing with our own relatives and families and friends, or even at the workplace. Okay, how do you think families should go about doing it?
See, it's not easy for people to disclose or discuss these issues because there are a whole lot of issues that surround disclosure to because you do not have control over how the other person's response is to your disclosure of the illness. So I think that degree of lack of control kind of imposes a challenge in terms of and their own understanding of what mental illness is. So I think there is a sense of perception that it may be a weakness or a deficit that is disclosed to another family member or to a person at workplace. So there are people who may take it differently. I mean, people who may be supportive. There are people who may not be very supportive and may discriminate because of the fact that you have mental illness. I think one has to use one's discretion where one is likely to potentially have benefits with disclosure rather than indiscriminately disclosing it to everybody. I think it's a choice that a person should exercise very discreetly, thinking about both the benefits and the costs of such disclosure. So it may be critical, say for example, in a workplace to disclose it to a very supportive colleague or a supervisor who may then be in a position to help you when there are challenges. So sometimes people decide to make a full disclosure and then decide that I disclose everything to this supervisor or to this supportive colleague. Sometimes they may make a very partial kind of a disclosure. They may say, I am taking treatment for depression or say treatment for, I am meeting a psychiatrist. So may not really disclose all facets of the illness itself. So I think depending on the kind of experiences that you have with your colleague or with your family member, I think you may wish to disclose everything to disclosing some aspects of your life. But this has to be done discreetly. One need not disclose everything to everybody. And sometimes non-disclosure is also helpful because then you don't have to face the consequences of disclosure. So I don't think we should broadcast everything. But there are some people who choose to broadcast and they believe that that kind of helps them and they don't really feel anything about broadcasting or telling about their illness to everybody. So I think it's an individual choice one has to make. It's very hard to change societal perceptions as an individual. Systemic interventions and a lot of changes that happen over a period of time might bring about greater awareness and a sense of legal obligation that people have towards treating others with respect and justly. I think those are things that may take time to change. I think some of these things done with some degree of use of discretion and personal choice, exercising personal choice wisely, I think would be useful.
Yeah. Any last few words you'd like to tell our family carers, Doctor?
No, I think many of these questions that you have asked are routine questions that we see family members usually ask doctors, and there are no straightforward answers that doctors can provide. I think over a period of time, both with experience both for the family as well as the doctor. I think sometimes the questions are answered gradually rather than in one go. And I think there are certain circumstances where these suddenly become imminent, and I think then that is when sometimes this interaction becomes very important. So, but I thought that all of these questions are very important for families to understand that there are different perspectives to these. And I think it's important to understand that there are no one size fits all kind of responses that you can have for these situations.
And also, it's also a message to family, other family members. Yeah, there are with similar situations across who are facing. It's not only them. Yes, that's right. Yeah. Thank you so much for giving us your time, Doctor, again. And we totally appreciate it. Thank you so much.
Thank you very much. Thank you.
Thank you.